Medications for opioid use disorders in correctional settings. Shifting the paradigm, creating a balanced correctional and rehabilitative approach. The Opioid Response Network is funded by SAMHSA to provide resources and technical assistance needed locally to address the opioid crisis. This video is part of a series to provide guidance on the implementation of medications for opioid use disorder in correctional facilities. Leading corrections and behavioral health experts present information on topics such as the use of medication, models of delivery, diversion, and linkages to care and community support. An interview with Rae Simpson, State of Washington Department of Corrections. You recently started an MOUD program. What was that like for you?
The state of Washington made a decision a little over a year ago to implement a MAT program. And I came in shortly after it was started, and so I got kind of hit upside the head on all the challenges that we were faced with. And because of the opioid crisis that everybody is feeling, it was the right thing to do. And some of the administrative team sat down in a room, they brainstormed, they thought they had it all figured out, they wrote everything down. It looked great on paper, and then when we tried to roll it out, we realized we had not considered everything we needed to think about. We didn't stop to think about how our patients might feel about implementing a MAT program. We didn't stop to think about how the custody staff might be involved. We didn't consider the line staff. How is the RN going to be able to actually disperse the medication and administer the medication? So we rolled it out, and we had a lot of stumbling blocks. We had to stop and start and stop and start.
What are some of the challenges you faced?
I would say number one challenge is we have several prisons across the state, and each and every one of them was doing kind of their own thing. And in some regards, they needed to because the facilities are so unique. Some had beautiful clinics that could accommodate lots of patients. Some had a huge campus that, how do you move patients in a safe manner? So they had to do a little bit on their own. But because we didn't have a formal protocol written, it gave them the opportunity to kind of bend the rules. So we are now sitting down and writing an actual manual. This is the how-to, the whens, the wheres, the whys, and then give them a little bit of leadway to obviously to make it work in their facilities. So I think the number one challenge is we didn't really have a formal protocol. Second one is the facilities. We just need to be able to figure out how do we accommodate the patient need. The third thing was education. We really didn't stop to think about an education plan and what that rolled out and what did that look like. The third thing is we didn't stop to consider buy-in. How do we get staff to buy in? They needed to understand the whys. Why is this important? Explain to them how it does improve safety and security. How is it going to make a safer environment for the patients and for our staff? And then also the whole, how do we do this? There was talk about, do we just do an induction when we get ready to release them into the community? Do we do a tapering when they come in? Are they going to have to taper down and go off of the mat? What about a maintenance? How long do they maintain it? So again, we had very unclear guidelines for staff, and that was a huge challenge. And then staffing. There's a nursing crisis, and all over. And how do we make sure that we have enough staff that are competent and capable of providing the treatment that we wanted to roll out? So lots of challenges, and we kind of are tackling them one by one.
How was the information that you received at this conference helpful?
I thought that the workshops have been fantastic. A lot of it has just been remind us that we're all in the same boat. Every one of us is seeing some of the same challenges. It's been great to network with folks and hear what's working and what's not working. I wish I had more time. I would have loved to have been able to visit some of the facilities here in Rhode Island to see it live and ask some hard questions. I wish there were more nurses here. I wish that there were more line staff that could have come and actually been able to hear it firsthand and actually ask those hard questions.
Is there a learning curve in Washington?
I think we'll always be learning, thank goodness. But I think we're really at the point now where people are feeling more comfortable, more confident. We've been able to pilot in a couple facilities, and it's been successful. And so we're able to, spin off of that and tell staff, hey, if that facility can do it, we can too. And then what we're doing is we're cross-training. So if a nurse or a physician has been super fantastic in one facility, they're coming to the next facility to train and be there. We also just hired an addiction specialist physician that's going to be our champion and help be there. And she's implemented a weekly meeting. People can call in, they can ask questions. We are actually doing case studies to actually talk about some of the challenges. She's just been a wonderful resource. So she will be leading us forward. So that's really exciting.
What are some of the issues specific to nursing?
I think that the challenges the nurses have had is better understanding of the actual process, because they want to just get in there and do it. And it's a matter of really breaking down the silos and understanding that it's not custody versus non-custody. It's not nurses against doctors. It's not patients against health services. We are all on this together. We're all one team, and we need to figure it out together. And so it seems really simple. I'm just going to identify my patient. I'm going to follow the order. I'm going to give the Suboxone as written. And then we realize, wait, that patient's on a different dose, that strip now doesn't come in the dose we needed. This nurse heard that the latest thing is an injection. Can we go to injection? Can we crush this pill? And so there's all these questions. And so it's really about listening to those questions, explaining to them, getting everybody on board, and just making sure that everybody understands why we're doing it. And when a challenge hits, let's talk about it. Let's brainstorm. Let's solve the problems together and try to be work from the ground level up. The staff, they're my worker bees. They're the ones that are seeing it, they're hearing it, they're feeling it. And so when they tell me there's a problem, I need to listen, and we are addressing it together.
What was the implementation process like?
Well, originally the idea was we were just going to implement an induction program. So any of those patients that were getting close to release, like 30, 60, 90 days, we would start an induction for those patients and then get them set up with a reentry staff member and move them into the community. And then we realized that we also have a challenge with our violators that are coming back into our prison system that may have been on a MAT program in the community. Now, what do we do with those? And now we're all of a sudden saying, well, do we maintain them? Do we taper them? How long are they going to be in the system? So what sounded like a great idea, we're just going to implement this beautiful induction program for everybody re-entering the community, wasn't as simple. And so we started off with 2 of our facilities, and now the plan is to roll out. And we will have 3 separate programs: the tapering program, a maintenance program, and an induction program. And hopefully it'll be statewide eventually.
Do you feel better about what the state and the facilities are doing now than what you were doing when you started your job?
Obviously, hindsight's 20/20. If I could go back in time and redo things, we would do things so much better. But when I think about all that we've done, we have done a lot of work in a very little time, and I would say we are well on our way to doing the right thing. There's going to be definitely bumps along the way, but I would say things are going really well. I'm very proud of Washington. The staff are fantastic. The program is working. We are saving lives each and every day, and that's what it's all about.
Technical assistance is available to support the evidence-based prevention, treatment, and recovery of opioid use disorder. To request technical assistance, visit opioidresponsenetwork.org.